Readers, welcome back for an informative session on the latest update on the COVID-19 XEC variant. In this video, I'll tell you all about this variant that everyone is talking about, 2 other flu seasonal pathogens in Alberta, some statistics, lab testing procedures, and vaccines. Make sure you watch the video to the end so that you'll be the nurse who is one step ahead of others. So what is the COVID-19 XEC variant? It is a subvariant of the virus Omicron. Think of it as COVID's great-grandchild. So here we have COVID's child Omicron. Then we have Omicron's children, KS 1.1 and KP 3.3, who have now produced the next generation, XEC. Traces of XEC was first found in Italy sometime in May of 2024. The numbers were so insignificant that nobody thought anything of it until the variant started becoming more noticeable in Berlin last month. COVID XEC has spread throughout Europe in this short period of time. Here is a 10-week graph by Alberta Health to show you all the different variants of Omicron found hanging around. The final week of observation shows traces of KP 3.3, which is the parent of XEC. Bear in mind that the flu season hasn't even started and we are already saying hello to KP 3.3. So the next big question is, how dangerous is this variant? According to multiple government and medical sources, XEC doesn't seem to be as dangerous as past COVID subvariants, partially because over time we have built a certain level of immunity. As for the symptoms, they are very much similar to COVID symptoms such as fever, cough, shortness of breath, sore throat, runny nose, nasal congestion, loss of taste or smell, nausea, and diarrhea. The mode of transmission includes airborne, droplet, and contact. For example, when a person sneezes, the water contained in the sneeze that is forcefully released is carried by air and travels quite the distance until it settles down after losing its momentum. This is also true when a person coughs. Contact precautions should be enforced, especially with high-touch areas or shared objects such as computer keyboards, phones, doorknobs, and handles. The 2 subgroups of Alberta population that are the most susceptible in contracting not only XEC, but any virus are the old and the young. The graph by Alberta Health shows infants under the age of 1 being the highest number of victims. The cause is very much related to how early an infant can receive the vaccine, which no sooner than 6 months old. On the other hand, older adults between the ages of 70 and 79 are also at risk, as research states the immunity level for this age group is generally much lower. How are positive cases confirmed? 2 ways. Lab testing, which we will talk about more in just a bit, and wastewater testing. Wastewater samples from sewage is collected and tested to see if these pathogens are present. When is a surge in positive cases expected? Around October, which would last till the end of winter season. Well, the good news is that the current COVID vaccines have been confirmed to have us all protected against the variant XEC. Let's look at some COVID statistics first, and then do a simple comparison between COVID and influenza in Alberta. The left side of this graph represents the number of lab tests that were done in thousands since the onset of COVID in 2020. On the right side, you'll see the percentage of confirmed positive cases. For example, in January of 2022, out of the 5,500 lab tests that were done on individuals, you'll see that 12% of them were tested positive. You can see that the graph clearly shows that every year COVID is at its peak between the months of October, November, and January. On the other hand, the virus influenza that has been dominating the virus clan all this while seemed to have taken a break when COVID started in 2020. COVID was much deadlier than influenza that many who were infected with COVID ended up wishing that they had influenza rather than COVID. Alberta's top 3 pathogens are influenza, COVID-19, and respiratory syncytial virus, or RSV. Think of these 3 as the parent virus and their respective variants as their children. As a frontline nurse in Alberta, this is the correct lab requisition that you will be needing when sending swabbed specimens to the lab. The top sections require information on patient demographics as well as the ordering physician. The bottom part of the requisition is where you need to pay closer attention to. So when a resident or patient is presenting with influenza-like illness symptoms or ILI symptoms, under the specimen and source tab, you will check off the type of swab taken, that is nasopharyngeal or throat. It is always best to do a nasopharyngeal swab for best results. However, you may have an uncooperative patient who might not or might only settle for a throat swab, and that's fine. Next, under the specified test section, you must indicate the desired pathogen to be tested. Are you only testing for COVID, COVID and influenza, or COVID, influenza, and RSV? When a patient is presenting with ILI symptoms, a rapid test is automatically done as a screener to rule out COVID. But because there has been instances of false negative rapid tests, nurses are defaulting to the third option, that is COVID and RPP. However, in order to request an RPP test, the patient must meet at least one of the criterions listed. The next section, clinical history, is a required field and very straightforward. This section primarily is to identify all the symptoms presented by the patient. The very last section asks to identify whether the affected person is a healthcare worker or a patient of a residential facility such as a long-term care or supportive living facility. In case you're wondering what this section is about, where it asks for an EI number, this is a number given to a site or a unit that has been declared an outbreak. That is, when 2 or more patients or residents have been confirmed positive for any of the 3 pathogens. This can be any setting, whether it's a nursing home, supportive living facility, or a ward or unit at the hospital. So for the 2025 flu season, be prepared to get poked 3 times. I know some of us hate needles, but that is the only way we can protect ourselves and those whom we dearly love. As for the influenza vaccine, there are 2 options. The Fluzone Quadrivalent or Flulaval Tetra, and these 2 are available for those 6 months of age and older. The Fluzone High Dose is only available for those 65 and older. As for the COVID vaccine, there are 3 choices that depend on availability. The Moderna Spikevax, Pfizer BioNTech, or Novavax Nuvaxovid. While all 3 vaccines are suitable for those 12 years of age and older, the Moderna can be given to younger children as young as 6 months old. The government of Canada hasn't announced the name of the RSV vaccine as of yet, as it is expected to do so in the coming weeks. Leaders, I hope this video has been informative. If you have any questions regarding anything that was discussed, feel free to leave me a comment below and I will be sure to answer you at my earliest convenience. At the end of the video, please do not forget to cast your vote as to whether you plan on getting the vaccine this year or not. As always, if you are new to my channel, do not forget to like and hit the subscribe button as a way of showing me that you would like to hear more informative videos from me. Till we meet again, signing off as the Teaching DOC.